November 1990, I was 13 weeks pregnant, and I was diagnosed with HIV at Johns Hopkins Hospital in Baltimore, Maryland. I was living there at the time. I decided to keep my baby. I was told at that time that the option was to terminate my pregnancy or risk myself and my child both being dead. I made the decision to take the chance on God, and I had a son. My son is now 21. He's not infected with HIV at all. And as a result of that diagnosis, I began to address HIV as a whole.
When you were infected as a young teenager, how was the discussion on HIV/AIDS at that time?
In 1990, as a woman, I did not know that I was a woman at risk. I had never been an IV drug user. I was not very promiscuous. I had steady boyfriends. I'm from a middle-class black family in the U.S. Really wasn't a message that I was a person at risk. And when I took the test, I was just taking the test as part of a test offered to all pregnant women at the clinic that I was in, just as a routine test. So I was not looking for a risk or any option to come back positive for this test.
At that time, there was no antiretroviral treatment. How did you feel?
At that time, actually, what the doctors told me when I decided that I wasn't going to terminate my baby, they told me it was a 25% chance that my baby would be positive. I think I got depressed for a while. I got depressed for a little while. Before HIV, I've had some other life struggles. I had been dealing with, at that time, I was a substance abuser, had used drugs, snorted cocaine, smoked marijuana. I had been free of doing that for about 4 years at that time, as well as I had been raped a couple times, twice between the time I was 15 and 20. And so HIV was not something I was looking for. I still was healing from a lot of other things in life. So I kind of felt hopeless, kind of really despaired for a while. But at some point I really decided that I needed to trust God. I needed to trust something. I didn't want to die. I wasn't willing to be, at that time I was 25. I wasn't willing to die at 28 years old. So I decided to fight. I decided to leave my son a legacy, and to do that meant that I had to be willing to fight for my life.
When the medication came 1996, how were you? Were you sick at that time, or?
Well, no, I've never been sick from HIV. I actually delayed treatment. So medicine did become available in 1996. I was working at Johns Hopkins at the time as a women's health advocate, and I actually delayed treatment because I didn't know what the research was saying about women. Women were not part of the research agenda. I was really afraid that medication wasn't tested in women, and as well as people that look like me. Not many people of color was part of the early testing, and I really waited a few years to see what was happening for more research to come about. Plus, I also wasn't willing to take on then the pill burden that went along with early treatment, the amount of medications, as well as some of the side effects.
And how is it today?
Today is wonderful. I'm in treatment. I've been on treatment for about 7 years now. Have been undetectable the entire time. I've been on the same treatment. I take 3 pills a day, once a day. And I plan to be here. I have no worries on HIV and taking my life today.
Why are you an activist?
I am an activist because I choose to live. I made a decision to live, and in making that decision to live, I became educated. And I found out there was a lot of things that was lacking. As many things was going well, there still was a lot of things lacking. I'm an activist mostly among women. There's a lot of inequality still happening with women. There's a lot of gender-specific opportunities women need to be able to reach other women, to be able to access health care, to be able to take care of their families and their communities. And I think mainly when I was first diagnosed, when I first started doing this work, I was working in a clinic at Johns Hopkins, and women unlike me whose children was born positive, they needed someone to speak on their behalf. So when I first started this work, I started speaking on the behalf of those women who were afraid because they had positive children.
Did you yourself experience stigma?
I can say I don't think I've ever experienced stigma, simply because I decided not to allow stigma to experience me. With some of the other things I was saying, I've already used drugs, I've always been fluffy, you know, I've always been black, I always have a lot of other things to deal with stigma. Stigma and HIV wasn't an issue for me, it was a secret that I couldn't keep. I've kept a lot of secrets. I kept my rape a secret, I kept molestation a secret. I could not keep this secret, so it wasn't that issue for me.
Do you think it is important that the people who are living with HIV and AIDS, that they are coming out and become open?
I think it's vitally important. I think it's vitally, you see I wear a button to say I'm HIV positive, and I wear that because it's freeing to me. It's freeing me, and it allows the community to normalize the conversation. I'm like any other person who have a chronic illness, you know. I didn't do anything that anyone didn't do. I had some unprotected sex. And I'm sure pretty much almost everyone I've ever met who've had sex have had some unprotected sex, you know. So therefore, stigma is real. I wish that everybody would, but I do understand and I respect people who can't come to this place yet. There's a lot of different reasons why people don't come, but I do advise and really trust people to take the risk, because there is some risk there, and to come because it really is healing, it really is freeing, and I can get what I need, not because of HIV, because of my willingness to be honest.
What is your message here at the AIDS conference in Washington?
My biggest message here is that is women and gender equality, and really understanding the unique complexities of women, and really understanding not only our funding, but how do we change political will, you know, here in the U.S. and abroad with governments, to really understand the importance of creating opportunities that are seamless for women, not only to access care, but to get their needs met and to be able to take care of their community. We have to get women at tables of authority, tables of leadership. Most of our systems with HIV was designed and created at a time when this was a white, gay, male disease, and the systems wasn't designed to incorporate me, a mom, me, a wife. You know, the system wasn't incorporated for my husband, who's a heterosexual male. So really we want a network that really allow women to be women and to deal with our complexities ourselves, to be able to educate and make our families whole. That's what women do. So it's really about creating the opportunity. It's about ensuring women human rights, reproductive rights. You know, at my diagnosis, it was 4:30 in the afternoon. They offered me abortion that day, versus really giving me the understanding of treatment of what can happen, as well as a woman who did want an abortion, who not to be victimized, not to receive condemnation for whatever her reproductive health rights are. Women have the right to make those individual choices.
What is your son thinking about your activism?
My son, interesting, at 21, he's always known about HIV. It's never been part of a secret. He has, probably in his early teenage years, he was kind of sad because it was when he was really trying to figure out all what it was. But today he's an activist himself. He educates his community. He's here today at the conference. He's been with us since Saturday, helping in the Global Village, talking to young people as well. And he's, more than anything, he talks to the young people that he lives around, that he networks with, ensuring that they're practicing safe sex messages, that they have access to condoms, that they have access to the tools and information to be a generation free of HIV and AIDS.